The British Columbia drug crisis is spiraling out of control. According to the BC coroner, more than 6 people die every day from toxic drug deaths. Images of homelessness encampments with strung out drug users splash across the media regularly. Tensions run high in cities like Vancouver and Victoria, where residents feel the drug crisis is threatening their community safety and even their health. And what is fueling this drug crisis? Some suggest it's the BC government's program granting safe supply, meaning free drugs, which is to blame. Others say the increased cost of living is driving up homelessness, and couple that with a mental health crisis, many people turn to drugs. One researcher and psychologist, Dr. Julian Summers, has been speaking out and sounding the alarm over the data he has collected over the years. This database of data has been used in over 30 provincial reports and 60 peer-reviewed publications. In 2021, however, Dr. Summers received a letter from the BC government demanding that he destroy the database of research within 1 week. 1 week. There are allegations that this move was politically motivated. Dr. Summers initially very well refused to comply. So what is so troubling with the data collected by Dr. Summers? What does it say? What is the solution to BC's drug crisis? Well, joining me now for an in-depth discussion is Dr. Julian Summers, a clinical psychologist and distinguished professor at Simon Fraser University, where he directs the Center for Applied Research in Mental Health and Addiction. Dr. Summers, thank you so much for joining me today. It's a real pleasure to have you on.
Pleasure's mine, Tanya. Thank you.
So just to give some context to our viewers, what exactly is the situation at present in British Columbia?
A widespread drug poisoning crisis. As you've said, the numbers of people that we're now losing each day are maybe closer to 7 than 6. It's been an increasing crisis now for a number of years. And, it's critical to keep in mind that there's no way to have an ongoing death crisis unless there are new people entering into higher and higher levels of risk, continuously replacing the people that we're losing. So there is a massive proverbial iceberg below the surface of the water that we see and that we talk about when we're referring to these deaths.
So what is precipitating this drug crisis? I outlined some concerns. We have increased homelessness. We have homeless encampments. We have, especially since COVID, it seems to have been an exacerbated mental health crisis. How do all of these things factor in to, fuel a large drug crisis?
Well, we know some of the factors. One of the things that is not contributing is a shortage of money. We're spending huge amounts of public funds, really so far fruitlessly. We've known for a number of years, starting in 2006, that the average cost to taxpayers maintaining people living homeless on our streets in BC is about $55,000 per person per year. We're, if anything, spending more than that now. You're correct to emphasize the importance of housing costs and just affordability, living affordability. But there are a couple of other pretty conspicuous factors here in BC. We have completely failed to deliver on the promises made to citizens around deinstitutionalization, when we said that housing people all in one large place together for the rest of their lives, if necessary, was not the way to go, and that people had better experiences and better prospects for recovery when we provided them with supports in their own communities. This is knowledge that really helped to mobilize deinstitutionalization 50 years ago. So it's not new, but in those intervening decades, we've had the opportunity to show multiple times, including in randomized controlled trials in Canada, that indeed this plan to support people in communities works and results in far better outcomes for them and for the communities themselves. Less crime, fewer medical emergencies, and so on. So that's a big one.